The good news is all the vaccines seem to give us a lot of immunity. It's about 70 some percent for all of them. So that's really good. And that's one of the reasons we've done this controversial delaying. So if most people 75% for one dose, and then you can boost it up to maybe 90, but we just don't know how long that will last, right? So it's a big unknown, kind of a real world experiment. We're trying to balance this, getting as many people vaccinated versus, getting them fully vaccinated. So it's a difficult balancing act, like everything in this.
Out in BC, we're seeing a rise of the P1 variant, which is the variant connected to Brazil. How concerned should we be about those variants in relation to vaccines? Do they work?
Yeah, so this Pfizer study that came out this morning was really good on that. It showed that the vaccine is very effective against B1351, so the South African variant. So that's really good. There's some evidence that AstraZeneca didn't work with 1351. South Africa stopped using that vaccine altogether, and so have a few other countries because of that. But that wasn't great research. But it's looking like there was a lot of worry at the outset that they wouldn't work against variants, but they seem to be working pretty well. The good news too about mRNA vaccines is the way they're manufactured is that they're actually easy to adapt. Mm-hmm. They can adapt to, we can make these slight variations to target now the B117 is becoming the dominant strain. So when Pfizer, when Moderna start producing more vaccines, they'll do a little tweak and make it targeted slightly different part of the spike protein that the viruses that the vaccines target, and it'll make sure that it's a little more effective. So pretty good news on the variant front with vaccines.
We almost need to consider that we're in a new pandemic right now.
Yeah, it is, and I've written this. It's like a bit of a parallel pandemic. We have coronavirus classic, as we call it in our news meetings, like the old Coke, and then we have the new Coke, which is the variants, and they are quite different in that they spread more quickly. I think, it's hard to put a number. I read things at 60% more likely to catch it. And what does that mean to people? It doesn't mean anything. Steiny Brown this morning at a briefing, I thought, explained it in a way that's easier to understand. He said, people used to come into hospital one at a time, and now they come in the whole family.
So this is different. But what is not different is that the weapons that we have to fight against COVID-19 still work, and work well.
It makes me crazy every day. I get emails and tweets from people saying, hey, but deaths are way down. Everything's great. But deaths are a lagging indicator. We're going to know in a month or 6 weeks if there's a lot more deaths. And we can't just sit on our hands for that time or else it's too late.
What do you think is necessary right now to stop this spike in cases?
Yeah, I think first of all, we need to stop using this false language of lockdown. It's not anything remotely. I've taken to calling it a mockdown instead of a lockdown. I guess the simple answer would be we have to stop having all these exceptions to the rule. So the rule is, stay home, go outside, and don't gather. I think we have to pay a lot more attention to workplaces. We know workplaces are driving a lot of this. Why are 600 people getting infected at at a warehouse, Amazon warehouse outside of Toronto? Well, obviously there's not good enough measures. We have to crack down on the safety. We have to protect workers. So it's just, just being a lot more strict on a lot more things just for a short time, but we have to do it. And then the final one is the time. We can announce, we're going to do this measure for a week. In France yesterday, they announced a lockdown that's really a lockdown, and it's a month. It's at least a month. And the president went on TV. He made it clear, we're doing this for 4 weeks. And if you don't follow the rules, we're going to do it for 8 weeks. You have to be strict and you have to be clear from the get-go, and you have to enforce the rules.
So how do we balance that? The fact that in lockdowns, people are losing their businesses, they're, having to give up their homes. So how do we balance that?
I think we have to stop talking about it as a balance. I think it's a false dichotomy. Good public health is good economics. I think that's what we ultimately have to remember. Why have the Maritimes succeeded? It's not just because they have small populations. It's because they took that approach from the get-go. They said protecting people is protecting the economy, and their economies are roaring. They're doing exceptionally well. The worst possible thing, I think, is what we do in, especially Ontario, open and close, this constant, just tiresome. Nobody knows what the rules are anymore. People think they're going to open their restaurants for Easter weekend, and they buy all these supplies, and then the government changes their mind. And they waste. That's way worse for business. I defy anyone to tell me what the rules are in any particular part of Ontario at this point. It's just confusing. But I think I've said from, we started talking about this in January 2020, we always have to keep our eye on the long game. This is a marathon. We thought at the beginning it's turning into an ultra marathon, but we still have the same goal. We want to get to that finish line, and we want to get there standing up and able to celebrate. And I think we are going to get there. And there's a lot more hope today than there was a month ago, and even more hope than there was yesterday.